Hi, Mackenzie Pederson, SPCE682, Dr. Randy Melvin Brown, September 9th, 2024. Okay. My goodness. Okay. This is half the deck. Okay. All right, here's the timer. Starting it. Okay. Quantitative marker to judge if the individual learned a specific behavior. Maintenance. Varying non-critical aspects of instruction. Pass. Contingent access to higher probability behavior reinforces lower probability behavior. Priming. Involve instruction of acquisition tasks interspersed with mastered tasks with typically short intertrial behaviors. Pass. Exists when the client is able to perform the skill but chooses not to do so to insufficient contact with reinforcers in the environment. Performance deficit. Planned activity check, an observation system in which the observer counts the number of individuals engaged in a behavior during a particular interval of time, useful in classroom settings. Structured play. Time. Requires a verbal SD, which is followed by a nonverbal response, listener responding. An imitation training procedure, which capitalizes on delayed imitation to evoke an imitative response in the presence of an SD. Modeling. Video modeling. An overcorrection procedure in which the individual repeatedly practices a positive alternative behavior used when there is no environmental disruption. Pass. Responses which have been reinforced in the past in the presence of a specific antecedent stimuli, also called the discriminative stimulus or SD, are said to be under stimulus control. Stimulus discrimination. When behavior happens in the presence of a new stimuli or settings. Pass. Extent to which a treatment is fair, reasonable, appropriate, unintrusive, likely to be recommended to others. Pass. Includes a determination of whether the resources and supports that are required for the intervention to be implemented are present in the situation. Pass. Feasibility. Typically includes an analysis of the quality, quantity, and consistency of the literature related to either the effectiveness of one treatment across populations or the effectiveness of any treatment for one given population. Reliability. A procedural form of extinction that involves simply ignoring behavior. This would only be effective in eliminating the behavior if the behavior is maintained by attention. Planned ignoring. A child playing next to another child and engages in a similar activity without direct social overtures. Parallel play. The extent to which alternative explanations that are not the independent variable for changes in the dependent variable are ruled out. Pass. Small group activities with a defined area, activity, theme, and roles, incorporating typically developing peers and adult scaffolding as needed to support the learner. Structural play groups. Embrace the participants' values, expectations, traditions, and ideas. Pass. Should be made with the stakeholders and should drive the process for treatment selection. The goal should prioritize client health and overall well-being, safety, and independence. Should be observable and measurable. Selecting treatment goals. Treatment goal. Set of evidence-based strategies used to increase quality of life and decrease challenging behavior by teaching new skills and making changes to a person's environment. Pass. Behavior support. An individualized instructional strategy that focuses on building fluency, charting, acceleration, and reinforcement. Pass. Make the instructional and natural setting as similar as possible. Something common stimuli program. Objects, pictures, or symbols that are used to provide info about an activity, expectation, or routine may be paired with or used in place of vocal cues. Visual support. Shared attention, an important skill for young children to master. That serves as a prerequisite for many social skills. Shared attention, joint attention. A reinforcement strategy designed by William Jensen in which the students earn tokens or points to access a reinforcer, but does not know when or what will be accessed. Often uses an invisible marker, can be implemented with individuals or groups. Mystery reinforcement? Mystery motivator. Involves stimulus presentation by instructor, learner response, consequence, and interval between trials. The learner can respond only when presented with an opportunity for response. Inter-trial interval length should be altered based on the learners responding. Materials required would be accessible, instructional and stimuli available for quick presentation, and recording instrument for data. Data collection can include percentage of correct responses or trials to criterion. Discriminative stimulus? No. DTT. Okay, thanks.